Hello, everyone, and welcome. I'm Dr. Krystal Lynn Couture, the Pelvic Acu, and this is the Pelvic Bowl, episode 3. I'm joined today by Seonim Cho, who is an acupuncturist in the Maryland and Virginia area. Let me tell you a little bit about this very, very sweet and knowledgeable practitioner that I had the pleasure of meeting back in May. Sonim Sunim is a board certified and licensed acupuncturist specializing in pelvic floor health, pain management, mental health, and sports medicine. With advanced training in integrative pelvic care, she is passionate about bridging Eastern medicine with modern biomedical understanding. Trained in both South Korea and the United States, she currently practices in Washington, D.C. at Cherry Blossom Healing Arts and sees patients weekly in her private practice in Tysons and in Fairfax, Virginia. Her approach is rooted in evidence-based whole person healing and continuous learning. Welcome, Sanim. I'm so glad you're here.
Hi.
It's such a pleasure to have you join us today and to come together and congratulate you for completing your advanced certificate in pelvic care for acupuncturists.
You're welcome. Thank you so much for inviting me.
Absolutely, my pleasure. So, why don't we start with having you tell us a little bit about your journey as a healer leading up to the pelvic care advanced certificate, sort of that moment when you felt like pelvic care would be a specialty that you would want to grasp.
Okay. Before I learned about pelvic floor care, I often spend whole sessions palpating the patient's body to find pain patterns.
Mhm.
1 hour always felt too short to assess and treat everything my patients needed. Back then, I didn't even know about the pelvic floor specialty. The idea of pursuing a specialty felt overwhelming, but eventually I realized this area was too important to ignore. Um, that's when I started looking for a more focused, root-oriented the approach. And pelvic care completely transformed my practice.
Mm. Wow. So I love that you said the pelvic floor was too important to miss, um, because that's so much of what I love about teaching pelvic care to acupuncturists and really integrating in. So, what was the turning point or the primary reason that you wanted to bring pelvic care in? It sounds like it was getting to the root of the medicine, but can we go a little deeper into that?
Of course, I started seeing that I wasn't getting to root cause of patients' pain symptoms.
Yes.
The breakthrough came when I realized I had been treating the low back, glutes, and pelvis as a separate part, when really they are all connected about around all the time. So I met you, and looking back, I saw so many cases were pointing toward the pelvis. As I told you, my colleagues and friends were talking directly about pelvic care, but the parents clearly led there. The realization became my turning point. That's what I was.
Yeah. Wow. What a cool journey to be able to like see how the story of your clients, through their pain really evolved, bringing you closer and closer to the pelvis, right? And and drawing you in. Like the universe was saying, Sanem, this is your specialty. This is what you're meant to do in the world, right?
Yes, I'm so
Beautiful.
happy for that.
Yeah, beautiful. I love that. And I love, one thing I love about how you practice, because I got to see you at a practical, is just how much care and attention that you bring to your clients and
Mhm.
how you really witness their emotions and what sort of happens through the process of treatment step by step. So it was really an honor to witness that and to see that, because the emotional piece is important with pelvic care as well, right? So many people come in to see us
Yes,
for the pain, and then the
of
emotions are
course.
layered, right?
It is.
Yeah. Um, so what would you say has been your greatest asset or tool in your toolbox since you've earned this specialty? What are you kind of always going back to? You know, we might have our favorite muscles, we might have our favorite spirit points, we might have our favorite manual techniques, whatever it might be. What's your nugget? What's the thing that really seems to move the needle for you?
Oh, you mean the greatest asset for
Yes.
me? Um, Maybe this is a wrong answer. Why not? I don't. Maybe I think the greatest asset has been being able to find the true source of pain in the lower back, hip joint, SI joint, and more. Before I focused on patterns, but now, of course, I need to find out the patterns. But now I feel like I've uncovered a new layer.
Yeah.
There are still more layers to explore, but finding the most urgent one has helped me treat patients more effectively. Before I using like 100 needles, now maybe 10 needles
Wow.
for more effectively. I've also gained colleagues who share this passion. We met monthly, share difficult cases, and support each other with you. I have so much humility and respect for those ahead of me. Sharing knowledge and growing together has become one of the greatest gift. That's my biggest asset too, I would
Mm.
say.
Yeah, so two big assets, right? I actually love this because they're not necessarily two that most commonly come up. Um, the asset of community. So finding community that existed within your local, and also coming back to our little pelvic care community with our monthly grand rounds and things. I love that community is one of your assets, because that means your learning can evolve, right? And you can rely on
Yes,
others for their experiences, their case studies to progress, to learn more, to share your ideas with. I'm absolutely in love with that. And then the other
thank you.
concept is the refinement from using a more diverse needling perspective to really
Mhm.
refining to more specific, using less needles and getting bigger results. And I actually would say, you know what? It sounds like, Sonim, there's a third one there, which is that there's a layering. And this is something that I love about pelvic care the most. And it's the layering of the TCM pattern with the
Mhm.
biomedical pattern. And, you know,
Yes.
also for some of us, really getting deep into the spirit as well and the source. So it's cool to see, like, there was so much wisdom that just came out of that one question about what's your greatest asset, because you could have easily said, oh, you know, I love treating the adductors is great, and that could have been the end of it, but you went so deep, and that just really speaks to your spirit.
Oh, wow. You got it. Thank you.
Yeah, for sure. And I think it's so important to be vulnerable. I know that you know, interviews are not something you've done a lot of, and you're here and you're being vulnerable, but you're sharing something that is really important when we're talking about pelvic care as practitioners. So thank you for being vulnerable. Thank you for sharing. Thank you for everything.
Oh, yeah, thank you a lot. Thank you.
Yeah. Um, so if you had to share a client success story since you've started this work, what's the one that really, you know, illuminates your spirit, that says, yes, this is the work. This is such a good result. I want to keep going. I want to experience more of this.
Oh, okay. I would like to share a short two story, maybe I
Yes,
can.
of course, please.
Um, yeah, I want to share the story of a woman in her 30s with a chronic low back pain. who had never had pelvic or glute treatment before because she felt shy. She is a tourist but single. So I explained it's important and with her consent, treat her pelvic floor.
Yes.
Her pain, her pain decreased by 4 points after one session,
Wow.
and she booked 10 more visits.
Wow.
And I treated another patient, a male patient,
Mhm.
who had a tilt pelvic and rotated one side
Yes.
and frequent urination and erectile dysfunction.
Mhm.
Um, he came to me more than 4 times to me before I learned the pelvic floor. I treated for ashi point and kidney, like a channel TCM practice.
Yes.
But after learned this one, instead of the just treating local pain, I also referred him to pelvic correction specialist and combined with acupuncture, his pain reduced by 50%.
Wow.
Releasing pelvic tension also helped his stress, anxiety, and depression. It showed me how closely the body and mind are connected. That's one of them for one and man and male and woman cases for me.
Wow, that's amazing. So I think the really amazing thing, your first story, right? It speaks to clients and it speaks to acupuncturists. And I think that's something really special when we're able to work with a client and they're able to say yes to something that they really need, like pelvic floor needling. And she said yes to this. And then she had a significant reduction in her pain. That's awesome. That's a client result, right? And it's a pelvic care business result because she immediately booked 10 more sessions and was like, this is working for me. This is so helpful. Nothing I've tried has worked before. My pelvis feels better. I don't have the pain with the intercourse and I don't have low back pain, right? That's
Yeah,
yeah, so that's such an amazing result. Congratulations. And
thank
with
you.
your male client, once again, when you add in that layering, right? Look at the pattern of did you say kidney chi deficiency or kidney yang deficiency?
Kidney yin,
Kid,
kidney yang, and kidney chi, totally kidney deficiency.
total kidney deficiency. So when we layer that kidney deficiency, right, with getting into the pelvic floor, with
Of
using,
course, liver chi stagnation,
yes.
not only one symptoms. Yeah.
Yeah. So then
Yes.
all of a sudden we go from, you know, TCM can make a difference, but I always see it kind of making a difference a little bit slowly, right? Like it takes a commitment from the client. And sometimes they don't want to commit to a result that they can't see or feel or experience right away, right? Because we live in this Western world of we want it, we could get it now, we can even have it delivered to our house, right? So when they kind of want those results or expect them, and we're providing something that's under the surface, if we layer that with something that all of a sudden they can feel, they can experience, it's like, oh, I'm not getting up 4 times to go to the bathroom at night. And, other stuff is happening too on a more deeper level. Like my anxiety is improving. That's weird. I don't know why. I don't understand it. But they might not have had the awareness of that if we hadn't provided the tangible result. And
That's
why
true.
while going to the source is the key, right? Like we always want to go to the source, and the pelvic floor is very often the source. We, in order to change the pattern, I think we have to have the client buy in. They have to be
Mm-hmm.
on board. And to get them
Mm-hmm.
on board, they want to see results and they want to see results as quickly as possible. So I love that,
Correct.
both of your stories here show the sensitivity that you
Mm-hmm.
bring as a practitioner and the potency of the medicine that you share, which is an amazing gift to your clients. And also a gift to acupuncturists who are listening, how they can see how adding pelvic care can really transform their practice, can really help them to elevate what they're already doing, especially for these clients that are coming in with the back pain, and SI pain and the bladder stuff, right?
Correct.
Yeah. Oh, I love that. Um, so what would you say to another acupuncturist who was thinking about adding pelvic care to their practice or their repertoire, but weren't really sure if, this is a specialty that they could get into? They might have some fear or apprehension or uncertainty. What would you tell a colleague?
Um, okay. I've learned that the pelvis truly is the foundation center of the body. Um, it is misaligned. If it's misaligned, the whole system suffers. I can see many of the case. Pelvic care is not just another technique. I think it helps us go deeper and bring in the balance to body and mind. That point is really, I like it, because body and mind together, because we treat whole person. It
Yes.
can be a key for treating chronic pelvic pain, urinary incontinence, menstrual issue, fertility challenges, including IVF support, and PMS and postpartum recovery, digestive problems like IVF or like GI issues,
Mhm.
menu, and postpartum recovery also, like menopause symptoms, and stress, anxiety, or trauma, and more. So it lets us address physical pain and emotional health at the same time. Adding this to your practice upgrade your care, and patients feel the difference. You will see every in the table, they crying. This work opened a new perspective for me, and I'm so grateful for the growth it brought. I'm so thank you. So you
Mm.
must add this pelvic care practice if you can with the Krystal.
Oh, thank you so
Thank
much.
you.
I appreciate that, for sure. But Sanim, it's really interesting that there's this thread of the emotions that come through, and it just speaks to who you are as a practitioner, that you're there to support your clients when they're emotional, when they cry on the table, when we needle a point, we just, pick a point on the sacrum and the tears start to flow, or we needle the adductors and everything lets go. And it may be related to trauma that happened in the pelvis, right? But it may be related to something deep that's at the core of
Yeah.
this person that they've been pushing down and pushing down and pushing down. And the pelvis is where it sticks and where it holds. And what a beautiful release that can be.
True.
Yeah. Yeah. I really, I love that. And I love that you're taking the time and the energy, and you have the space to allow that beautiful release for your clients, because we all need a sacred and safe space to be able to do that. And clients who can find it through acupuncture are getting the benefit of what acupuncture is doing on a musculoskeletal, on a neuromuscular, on an endocrine level, and in the deeper energetics. And then they're also getting this emotional benefit. It's just beautiful to witness. And I feel that you're going to have such success, and that your clients are just extremely fortunate, um, to be with you.
Yeah, they are really appreciated. Um, as I met many cases that made me more like humble, and I like I can see what I need more study. So I'm so happy you are there. And I have questions, I can meet you every month and we can discuss with our colleagues together and alumni. We can meet there every month, Wednesday, 12 p.m. Zoom, during driving and working
Yes.
and lunch hour. I'm really happy for that. Thank you so much for everything.
Oh, you're so welcome. So, Sonim is referring to every month we do the Pelvic Acu Grand Rounds. And that's an opportunity for our pelvic care providers, acupuncturists mostly, to come together and share case studies and chat about things that may be challenging them or things that have been super successful or questions that they may have about what is going on in the world of the pelvis. And generally, each month we chat a little bit about some hot topic. So this past month, we chatted about pelvic organ prolapse because June is pelvic organ prolapse month. So we always pick a little topic to go deeper into. But our grand rounds are available for our pelvic care practitioners who've attended practicals or have done our online modules, or certainly for those who have done our advanced certificate like Sanim has. Um, so, Sanim, I have one more question for you. And you've mentioned that you came from Korea and you studied in Korea and then came to the United States. Is that correct? Tell me about that part of your journey. I'm really curious to know how the medicine that you learned in Korea and how the medicine that you learned in the United States has really like formed who you are.
Okay. I was working at the Husson University hospital for more than 10 years
Wow.
as a, but not an acupuncturist. But my professor was two of them. One was a surgeon and one latest, he passed away. Sadly, he's Sugan Hwang, who worked for sports medicine. And Sayer John was acupuncturist, also a medical doctor.
Mhm.
They collaborate one integrative medicine class opened. I attended that class that made me so much like, aha, that's what we needed. He always emphasized you need Eastern medicine combined together. That's good benefit for the patients. So they teach us really great lessons that if you working with only Western medicine or if you working only for the Eastern medicine, that is kind of a handicap. You can call handicap. So you need to treat whole person, but you need to combine Eastern and Western. I was 20, age of 20. So I was not understand what is that. And then I not accepted the Eastern medicine. Even my mother was working as pharmacist and acupuncturist as a without license as a like missionary worker.
Wow.
But I helped her. I saw many benefit of that, and I grew up with like a medical medicine field, and I saw many about the Eastern and Western together, the benefit. But when I met the Seiljan and Sugan Hwang, was like, wow, they are super. So I always thinking, what is this? And then when I came to US, I this is like my like a destiny. I feel like that. I was working businesswoman here, the 20 years as a businesswoman.
Wow.
Yes, but also at nighttime, I working at the Innova Fairfax Hospital for like a volunteer work and at the lab work and small clinic. I volunteered and Red Cross and then some like lab work. I always working the connection with the hospital because I love to care patient and meet the people to learn.
Yes.
So finally, one of my family pushing me to go this school, and I started. Wow, this is my goal. So this is my life goal. So I started, and I just immediately fall in love. From there, I just starting new things every continue education that I like interest. I go to Korea, Kyung University and Wongang University and Beijing, China for training, got the certificates, and still I'm learning with you and sports medicine with the medicalism, and I keep study. I have to learn for my patients' need because they coming new disease, so many things. The people alive, not like a statue. So we have to learn every like wake up. We need to wake up, not like their answer. So that makes me so humble, and I try to study more. And I'm so happy with you. That's
Oh,
that's all me
wow.
about
What
me.
what a journey.
Oh,
Yeah. So the seed really for acupuncture was planted when you were much younger.
yeah, I've seen many epilepsy babies, and my mother needed them like ship sons and bleeding out, and they almost die, and they alive. Many people so appreciate it, and still they are adult, older than me.
Hmm.
I've seen many their families there, still alive there.
Wow.
So happy for that.
Thank you for sharing that. So, Sanim, if
Welcome.
folks want to come and see you in your private practices, you have two locations. Can you tell us, all of us, where they can find you and how to best get in touch with you if they'd like to become one of your clients?
My practice in Tyson's Corner, we call beehive. I'm one of the bee there.
Mhm.
We have like a pelvic floor PT there, and I'm a pelvic floor acupuncturist,
Yes.
and we have a doula there, and so many like mental health there, and that's for like collaborate umbrella clinic in Tyson's Corner around Olive Garden. That's really close to Route 7. It's very downtown. It's just from Olive Gardens, 5 minutes behind the parking lot. And another location is in Fairfax, Route 50, very near 66. That's for one room with my friends who has a medical doctor. The right next room together we share. So I'm working on Thursday and Saturday in Fairfax, and Friday in Tyson's Corner, and other days working in Washington, D.C., Cherry Blossom Healing Art.
Beautiful. And how do potential clients get in touch with you? Cherry Blossom has a website, which we'll link in the show notes. But do you
Mhm.
have a website as well, or do you have a phone number that you prefer clients to get in touch with you?
Oh, yes, I just started this year and still working with the website, but I have a website. Like my name is SolPeak Heart. Sol means Latin sun. My first name is Sun.
Yeah.
Peak is peak mountain. So it's warm on top of the sun. Look at all the people who need. I want to care. That means soul peak acupuncture. So I made that. And the soul peak acupuncture, you can see the website. And also my patients comes from insurance company. They looking for their provider and they call me. They
Mhm.
are in all my information there, but
Beautiful.
still
So,
working on my website.
Okay, so we can link that in the show notes as well, so that folks can get in touch with you. If you're in the DC, Virginia area, Sonim is a beautiful soul and beautiful practitioner. Obviously, she brings the sunshine, which is her name, to everything that she is doing. The name of her business, SolPeak, just really speaks to who she is. So if you feel called to have pelvic care and you're in this area, what a gift she would be as a practitioner to you. I really hope you've all enjoyed this episode of the Pelvic Bowl with Seonim Cho. We've just had a great time chatting, and I'm so grateful and so humbled by the work that you're doing and by meeting you and your experience with us here at the Pelvic Acu. So thank you so much, Sanim.
Thank
And
you so much. See you soon.
see you soon. Thank you all for listening.